Hi, my name's Petitpas, and it is my pleasure to serve as host for Brief Contact Interventions in Sports Psychology. You might be asking, what are brief contact interventions? Well, unlike traditional therapy where a client comes to a clinician's office for a scheduled 1-hour appointment, sports psychology interventions can take place in locker rooms, before or after practices or competitions, or even on the phone. Typically, they're of brief duration, sometimes only 5 or 10 minutes. Nonetheless, in this brief amount of time, it is possible to help an athlete who may be having difficulty managing their emotions or dealing with a lack of focus. At the same time, brief contact interventions aren't magical cures. Typically, they're grounded within the context of an ongoing one-on-one or team consulting relationship in which the practitioner is able to somehow work with the individual to change their way and manner of dealing with distractions or other issues that may be getting in the way of their ability to perform. In a lot of ways, it's like first aid for the athlete who is in some immediate crisis or need. As you would see with crisis intervention, the goal is not to cure some deep-rooted problem. It's more so to help the athlete get back to a pre-crisis equilibrium. How does that happen? Well, it may be to change the way an athlete views a situation. It may be putting doubts in their doubts. It may be allowing them to see themselves doing something differently. Whatever the case, the key is to create some small amount of change that interrupts a pattern of non-productive thinking. These brief contact interventions, however, don't come out of the clear blue or out of some expert therapist bag of tricks. Instead, they're really grounded in established principles from counseling, gestalt therapy, cognitive behavioral therapies. The notion is that, first of all, you have to listen to and understand where the athlete is in the present moment. You need to be able to follow the athlete's needs and direction and focus, and then you need to find some kind of an entry point, a place where you can get in and help the athlete change his or her perception or maybe his or her behavior that then affects some later change that helps them be able to perform in the immediate moment.